Stop missing frozen shoulders. I'm Jack Chew from Physio Matters, and I'm fed up of you missing frozen shoulders. And yeah, I mean you. And I can say that with some confidence because we all have. I once referred a patient to an ESP for an unresolving subacromial pain, only to be shadowing that ESP when the patient came in as part of my injection training. I reassessed them myself only to realise my mistake from 2 weeks earlier. But you can stop these mistakes, and here's how. It seems such an obvious presentation, right? It hurts like hell, this vague symptom distribution, it's a vague presentation, a variable sense of cause from the patient, and it has an unknown cause too. Cervical radiculopathy, subacromial pain and various other local pathologies can easily masquerade, including serious, urgent ones. Early presentations aren't necessarily that stiff. Clinical questions, clinical signs and clinical tests are unreliable. There's a lot you can try for pain relief, but not a lot you can do, so onward referral happens and/or infrequent contact with that patient occurs. A recipe for missing a change in picture and therefore a missed diagnosis. It's a more variable condition than you think, and it's your fellow citizens that are developing it in all their variety and complexity. So of course it varies. Be a bit more cautious. Learn the questions and answers not to miss. Pain at rest and dull, deep background aching leans me towards frozen shoulder, but unreliably, as per usual. We don't understand frozen shoulder, but it has some endocrine, hormonal and rheumatological links, so don't be complacent, even if it has a mechanism of injury. Think, what else could it be? Avascular necrosis, tumours and lock dislocations can present as frozen shoulder. And here's the objective test that will make you some enemies who will then forgive you. When differentiating frozen shoulder from subacromial pain or cervical radiculopathy, shoulder range of movement is key, so test it properly. Active range of movement can give early clues, especially with combined movements. Then get to end feel, even if it hurts both you and the patient. So during your assessment, you would always be at some point getting your hands on and doing a palpation assessment. Always encourage that, regardless of how barn door the diagnosis might be. You might have realised in standing or in sitting that you've got most of your answers, but you always want to have a feel and make sure you're exposing the area. Very tempting sometimes. Winter, you've got 3 layers on, you might not strip it down to skin. Should always do that. There may well be dressings, other lesions, rashes that you might want to unveil that the patient might not know about that might be out of sight. So making sure you do at some point in your assessment be taking it down to skin and get them on a couch, not least because frozen shoulders are sore, they're stiff, they're tense, and so it may well be that this is a position in which the patient can try to relax into the bed, albeit with it being sore. One of my favourite handling techniques, really, especially for putting a patient at ease, I just ask them to just lightly hold onto my arm so that I've got full control of this arm, but still able to then add elements of rotation into that. Obviously, as we were describing before, passive range is really important for us to assess, and so we're looking at combining that movement where we're taking them into abduction and external rotation. Obviously, I'm not able to take it to end range there, but I'm just able to feel it as I might mobilise that joint, trying to then just putting pressure through the humeral head and trying to identify any areas of particular tension or soreness under my thumb. Now in this position, I'll be then trying to take it to end of range external rotation and combining that with different elements of abduction. And what we're looking for there, of course, is that end feel starts to become, you're taking resistance. When it is then truly stiff, you are in a situation where it may well get to there and that shoulder starts to draw forward. And so you may just apply a little bit of pressure, just trying to work out again, is it that then the patient is pulling against you? Or is it that they are truly unable to go any further? And so that's clearly what you're after. And as I mentioned before, you're definitely in a situation where you want to take it to end range, even though that's uncomfortable. So you'll be explaining to the patient, this may be sore, but it's important that we find this out. Combine the movements, use that capsular pattern, and then take it to a point in which it is both sore and stiff and will not go any further to make sure you're not misdiagnosing this. So as has been mentioned, range of movement is a crucial thing that we need to try and help to differentiate frozen shoulder from something like subacromial pain, cervical radiculopathy. And that's active but also passive end feel. Is it truly stiff? Now, one of my favourite things, not a validated test, it's more of an indication that you can get really early in an assessment. Halfway through your subjective assessment, you just want them to just demonstrate a part of range and comparing it to, especially if they've got an asymptomatic other side. So for example, Sarah, if you just copy me, and come out to the side. You notice there that Sarah's right arm is not able to abduct and externally rotate, and so therefore it almost drags as she lifts. And so what you want to do there is also feel the end feel. So as we bring it out into what might look like it's masquerading as full range external rotation, but as we come up, it's stiff in abduction and external rotation as we sort of challenge that capsular pattern. And that would indicate if it's a true stiffness, then that's going to be something that then we realise is more indicative of a frozen shoulder. Now, one of the most crucial things though is to say this is going to hurt, and explain to them that that is a cruel to be kind type test, and that whilst you don't want them to brace themselves against you and tense up, but you need to feel that end feel even though it's going to be uncomfortable. So warning them of that and being willing to challenge the shoulder that way is the things that's going to help you to not miss those crucial frozen shoulder diagnoses.